So PGD was originally developed to help couples who were at risk of transmitting a specific genetic disease to their child. So cystic fibrosis or beta thalassemia, there's a whole list of common genetic diseases that a couple may carry and be at risk of having in their children. So that's why PGT was developed. I was involved in the world's first clinic, and I started there just after they'd started. It was controversial. People still felt that we were playing God and we were narrowing the genetic pool because we were only picking people who were genetically more desirable, but we were really trying to prevent the birth of a child with a serious genetic disease. But then in the mid-90s, a couple of groups in the US decided to start using the same technology to do something called aneuploidy screening. So it's great theory that if we do this genetic test, we can look at the chromosomes in embryos from people going through IVF and put back ones that are normal rather than abnormal, especially in older women where there's more chance of them being abnormal. And to do PGD, what we do is we take out one or few of the cells from the embryo and we do a genetic test on that. So in the 90s, 2 labs in the States started offering this aneuploidy screening. So before, we'd been doing this procedure for specific genetic diseases, and now they were suggesting that maybe everyone going through IVF should have this procedure so that then we can check that we're only putting back embryos that are chromosomally normal. The trouble is, it's been highly controversial for many decades. In IVF technology, there's a number of what we've called IVF add-ons. So they're treatments that are not essential for you to have a treatment cycle, but they've been added on because the clinics normally claim that they'll improve your chance of having a baby. So if we're looking at the chromosomes, that would be the theory, that you're going to reduce miscarriage and you're going to improve the chance of having a baby because you've looked at the chromosomes. So what we need to do to prove this is we need to do a study called a randomized controlled trial. And this is where half the women would have none of the treatment and the other half have the treatment. And then at the end of the months or years that you do this, you then see what are the live birth rates of these 2 groups of women. So if we're saying the aneuploidy screening is going to improve live birth rate, and this is what most clinics market it as, we've done many publications about how clinics are marketing this and what they're saying on their websites, and they're saying it's going to improve your chance of having a baby. So if they're saying that, these studies should have shown that. And there have been so many studies, so many. In 2010, there were 11 large studies, large randomized controlled trials, and none of them showed it worked. Some of them showed it made it worse. They actually had a lower live birth rate than the control group.